So, hello everybody, this is David. So, today I want to discuss something on STIs or STDs, that is sexually transmitted infections or diseases. So, on this, these are very common conditions or diseases within the community. So, we'll check how they are transmitted, how you can prevent them, and some of these infections or some of these diseases. So these infectious, these are infectious diseases that can be transmitted through sexual intercourse, but not all of them are transmitted via sexual intercourse. Some of them can be transmitted via blood transfusion. We have vertical transmission, that is from mother to infant during pregnancy and also during delivery. Can also be transmitted through via body fluids like vaginal fluids, semen, and all those. So some of these infections, one can be bacterial infection, can be parasitic infection, can also be viral infection. Some of the bacteria causing these STIs, we have chlamydia, we have gonorrhea, we have syphilis. These are the conditions that are caused by bacteria, the bacterial infection. Then we also have parasitic infection that is caused by the trichomoniasis. Trichomoniasis is a sexually transmitted infection. It's a parasitic infection transmitted via sexual intercourse. Then you also have viral infection that can be HIV. You have human papilloma virus, the HPV, and the simple herpes virus. So all these conditions, we have signs and symptoms that are associated with these conditions. So if someone is having these signs and symptoms I'm going to state, then it's advisable that you seek a medical attention before the condition get advanced to another stage that can be much critical and very dangerous to human life. So some of the signs and symptoms, we have milky discharge from the private parts, either from the vagina, that's from female, and from the penile organ, that is from the male. We have lower abdominal pain or back pain. That one is can be from both male and female. We have painful micturition. That is, you feel some pain during urination. When someone is urinating, you feel a lot of pain. That can be as a result or due to those infections. We have the discharge, which I've said the milky discharge can be creamish, can be blood stained, can be milky like. So that discharge, when someone experiences or senses the discharge coming from the private part, it's advisable that particular person to get medical attention so that we test and get the specific condition causing that sign. For the male, we will have tender, swollen, and very painful testicles. Find that the testicles tend to swell, but they are very painful. If someone touches or you presses, they are very, very painful. So such cases kindly seek medical attention. Then we also have someone can feel fever. Fever is also due to this as a result of this infection. Then there's always unusual smell on smell either during urination or as a result of this discharge. So when you experience these signs, kindly seek medical attention so that we get to know the specific condition causing all these ones. Then apart from those signs and symptoms I've stated, there is always rash over the trunk and the hands and the feet, or around the groin, the neck, like this. There's some rashes around the mouth, oral region. There's some rashes that can be seen. These signs are very indicative, and never assume all these signs. There's also you can also presents with sores on the genitals or the oral or rectal areas, some sores, some small blisters, you can see the presence, kindly seek medical attention. On this, there are risk factors. Those who are highly at risk of acquiring or acquiring this infection. One, when someone is engaged in sexual activity, unprotected sexual activity, there are very high chance or high risk of acquiring this infection. So, those who practice sexual activities with which is unprotected sex are at high risk of acquiring these infections. Then improper or inappropriate use of condoms. If you improperly use and inconsistent use of condoms, up to a point that the condoms they burst on the way, the chances of acquiring these infections or diseases are always increased. Having multiple partners is also one of the factors that may increase the risk or chances of acquiring this infection. Multiple partners, there are very, very high chances. It's always advisable that an individual can have one partner of which both of you know each other's state in regards to these infections, so that we don't get infected or get infect our partners in either way. Then we also have those who are also at higher risk of acquiring these infections are those who abuse substances. When someone abuses substances like drugs or alcohol, excessive use of alcohol, what happens is that the judgment is always inhibited. So the judgment will be impaired, and this make them more willing to practice or participate in this sexual activity. So unknowingly or not knowing the status or the condition of the partner. Then there is also, apart from that one, we also have the vertical transmission, which I stated earlier, that is transmission from mother to infant, where during pregnancy or during delivery, when the mother is infected, then there are also chances that the baby can also be infected. So it's always advisable that all pregnant mothers get tested, screened, treated of the same. So on the prevention, before we go to prevention, there are complications that are always associated with these STIs. One of the complications someone will experience when the condition is not treated or gone untreated, we have pelvic pain. You will experience some pelvic pain. There will be PID, that is pelvic inflammatory diseases. There is also can also lead to infertility, which is very, very critical, very, very heartbreaking at one point or the other. There also pregnancy complication can also be felt or can also result to pregnant complication. There are also some certain cancers like the HPV, the human papilloma virus, associated with some certain cervical and rectal cancers. Then before we go to the prevention, there is a vertical transmission of which I have stated, where I have said that all pregnant mothers should always be tested or screened for these diseases, so that we always protect both the mother and the fetus at the end of the pregnancy period. Then on the prevention, the most reliable and effective way of preventing this condition is by abstaining. Kindly, we are always advise youths and all cadres of age that abstaining is the most effective and reliable way of preventing these STIs. We've also realized that avoiding multiple partners or having one partner which he or she, everyone knows his or her status in regards to this infection, is also a reliable way of preventing these infections. Then correct and consistent use of condom, which I've said it's very, very important, also prevent the chances of infection. We also avoid substance abuse, which impairs the judgment, so that someone is unable to make decision on what to take or what to be done at what time and at what place. We advise all the youth to avoid substance abuse. Then we also have wait, and this is very important. When someone gets a new partner, before you engage in sexual activity, kindly, it's advisable that you test and screen for all these tests. Thereafter, if you find that all of you or the both of you are safe, then you can engage. But before, it's advisable you test and screen before doing the test. Then there's also use of PrEPs, or the PrEPs. These are pre-exposure prophylaxis. These are drugs that are given before someone engages into sex. They prevent infections like they can reduce the chances of acquiring infections like HIV. Then for men are also advised to go through circumcision. The research says that the circumcision can reduce the risk of infection of up to about 60%. So this helps in reducing the risk of infection or transmission of this infection from one person to another. So kindly guys, go through this video keenly and check on ways someone can get infected. Those who are at risks of inquiring or acquiring this infection, and the complications associated with this infection, and last how you can prevent this infection. Kindly like this video if you are pleased with it, share, comment, subscribe. Thank you, and let's meet in the next video.